Hi, I'm Dr. Aaditi Acharya. I am a practicing gynecologist in Laxmi Nagar in east of Delhi. Today I'm here to talk about preterm births as we are celebrating Prematurity Awareness Week in the first week of November. We should be aware of what are preterm births, how can we prevent these preterm births, what are the related causes. So before we move further, we should know something about what do you mean by a preterm or a premature birth. So a preterm birth is a birth or the labor that occurs before completed 37 weeks of pregnancy and results in the birth of a premature neonate who is more prone for breathing difficulties, more prone for lung infections and other infections because of the lower immunity, can have more chances of an ICU admission and can be a leading cause of death all over the world. So before we move further, we should have a look at the statistics around the world. We have found that 15 million of the babies born in a year are born prematurely, which means out of every 10 babies who are born, one is born premature. In India, these numbers are somewhere around 3.7 million babies born out of 25 million, which is approximately 23% of the global preterm birth rate, which is a very, very high number. So we should be aware of what causes a preterm birth and how can we prevent it. Now, looking at the causes of preterm birth, the more important causes are firstly the infections. Infections like asymptomatic bacteriuria, urine infection which does not really cause symptoms. There can be other vaginal infections like bacterial vaginosis, Trichomonas vaginalis, Chlamydia trachomatis, Neisseria gonorrhoeae and group B streptococcus infections. There can be other maternal infections like toxoplasmosis, rubella and cytomegalovirus, herpes, which can be related to premature birth. We have also seen that in cases of antepartum hemorrhages like a placenta previa or an abruptio placenta can also cause preterm births. Then there are other causes like uterine anomalies. There can be a fibroid in the uterus which is again distorting the anatomy of the uterus.